Researchers are considering whether cannabis has the potential to be used in the treatment of COVID-19. Experts from the University of Nebraska and the Texas Biomedical Research Institute are recommending scientists study the addition of the cannabis-derived compound known as CBD to antiviral therapies. They say its proven anti-inflammatory properties make it a likely candidate to treat some of the more dangerous symptoms of the coronavirus. The FDA has only previously approved one CBD product so far to treat certain forms of epilepsy in children. For more, Forbes contributor Emily Erlenbach joins me now. She covers the intersection of cannabis with science, culture, and wellness. Emily, it's good to have you with us. Can you start by explaining what researchers have found in the bodies of people infected with COVID-19?
Sure. So in severe cases of COVID-19, what we're seeing is the body is releasing way too many cytokines. So this is a normal part of our immune functioning. Normally, cytokines will help to create inflammation to fight off infections. But in these extreme cases, you see so much cytokines being released into the system that it creates what's called a cytokine storm. You might see high fever, inflammation, severe fatigue and nausea, and in serious cases, it can lead to death through organ failure.
And in your reporting, Emily, you mentioned that reducing inflammation is an important strategy for fighting some of the severe symptoms of COVID-19, as you're describing. Why do researchers believe that cannabis could be a safer alternative treatment for COVID patients, specifically with lung inflammation?
Sure. So early on in the research into looking at how we could fight these cytokine storms, researchers noted that IL-6 cytokine inhibitors are something that could be helpful for this. So a lot of these medications that are already available have severe side effects. And so they started to look at cannabis, specifically CBD, which is known from previous research to be an IL-6 cytokine inhibitor. But there's actually other reasons that they've looked at CBD as well, for antiviral properties and also for how it can impact the ACE2 expression, all of which are related to the fight against COVID.
Well, two of the active ingredients in cannabis are CBD and THC. For people who are perhaps less familiar than yourself, can you explain the difference between those two and why one could be more beneficial than the other as a potential treatment for the coronavirus?
Sure. So they're, both actually compounds that have anti-inflammatory properties. But what we find with CBD is that it has far fewer side effects. So when you use THC, you're likely to feel the kind of high that's associated with cannabis. You may feel disoriented, have some memory issues temporarily. And more importantly, you can have issues like heart rate acceleration, which can sometimes complicate different medical treatments. CBD has very, very few side effects. So it's something that is being looked at as, a much more mild treatment that still has a lot of anti-inflammatory powers.
So, Emily, I'll be very real with you. Some people are going to hear this report and are going to think that this is all hooey, and others are going to think that this is an excuse for them to be using more CBD or THC products. So, give us a real check on where the research is at this point, and should people at this point be using cannabis as a treatment for COVID-19, or would you express caution about that?
Yeah, I would definitely express caution against that for two reasons. One, we're in very early stages of the research. To even this week, we just had a new study come out looking at this question using animal models, but we're pretty far away from human research that could really definitively answer these questions for us. The other reason for caution is that, cytokines are important in fighting off infections. So we don't really want to reduce them, as a preventative measure or in early stages of the infection. So some researchers have warned, that you may actually see a negative side effect from using CBD or cannabis early on in COVID infections, even though it may be extremely helpful when you get to that severe case where you have a cytokine storm.
So bottom line, more research needs to be done?
Absolutely.
All right. Emily Erlenbach, thank you for joining us.
Thanks for having me.